Hello, ladies and gentlemen. Before I begin my presentation, I'd like to introduce my team. I'm Hasna and my team Dinar, Fadilah, Lian, and Rahel. Today, I'd like to present about disease. Does everyone know about disease? Disease is any harmful deviation from the normal structural or functional state of an organism, generally associated with certain signs and symptoms and differing in nature from physical injury. There are so many types of disease we can discuss, but today we will present 15 disease. So please keep on eyes to our presenter.
What is anxiety? Anxiety is a feeling of unease, such as a worry or fear, that can be mild or severe. Cause of anxiety is stress, other medical issues such as depression, procedures related with generalized anxiety disorder, environmental concerns such as child abuse, situations such as surgery or occupational hazard, and substance use. Treatment will consist of combination of psychotherapy, behavioral therapy, and medication.
Flu or influenza is a common infectious viral illness spread by coughs and sneeze. It can be very unpleasant, but you will usually begin to feel better within about a week. Some of the main symptoms of flu include a high temperature or fever of 38 Celsius or above, tiredness and weakness, a headache, a general ache and pains, a dry, chesty cough. The best remedy is to rest at home, keep warm, and drink plenty of water to avoid dehydration. You can take paracetamol or ibuprofen to lower a high temperature and relieve aches if necessary. Coronavirus and other respiratory infections such as flu can spread easily and cause serious illness in some people. Vaccinations are very effective at preventing serious illness from coronavirus, but there's still a chance you might catch coronavirus or another respiratory infection and pass it on to other people. Symptoms of coronavirus include continuous cough, high temperature, fever or chills, loss of or change in your normal sense of taste or smell, shortness of breath, unexplained tiredness, lack of energy, muscle aches, or pains that are not due to exercise, not wanting to eat or not feeling hungry, headache that's unusual or longer lasting than usual, sore throat, stuffy or runny nose, diarrhea, feeling sick or being sick. What should we do when we get coronavirus? First is stay at home and avoid contact with other people if you have symptoms of a respiratory infection such as coronavirus and you have a high temperature or do not feel well enough to go to work or carry out normal activities. Do this until you no longer have a high temperature or until you feel better.
What is gonorrhea? Gonorrhea is passed from person to person through unprotected vaginal, anal, or oral sex without a condom. Cause of gonorrhea is sharing sex toys that are not washed or covered with a new condom every time they are used. Infected semen or vaginal discharge gets into the air. It can also be passed on to a newborn during childbirth, and the treatment of gonorrhea is with antibiotic given as an injection. What is insomnia? Insomnia is difficulty getting to sleep or staying asleep for long enough to feel refreshed the next morning. Cause of insomnia is physical health condition, poor sleep routine and sleeping environment, stress and anxiety, lifestyle factors, mental health condition, and medication. The treatment is a good sleep habits, cognitive and behavioral treatments, and sleeping habits.
Kidney stone is a stone that blocks part of the urinary system, such as the ureter and urethra. This is more likely to happen if you don't drink enough food, if you are taking some types of medication, or if you have a medical condition that raises the levels of certain substances in your urine. Most kidney stones are small enough to be passed in your urine. Larger stones may need to be broken up using ultrasound or laser energy. Occasionally, keyhole surgery may be needed to remove very large kidney stones chirurgically.
Next, epilepsy. What is epilepsy? Epilepsy is a condition that affects the brain and causes repeated seizures. In over half of epilepsy cases, a cause can be found. If there is an identifiable case, it usually involves the brain being affected by a condition. There are two main categories of epilepsy. First, idiopathic or primary epilepsy is where no apparent cases of epilepsy can be found, but there may be a family history suggesting that the condition is inherited. Second, symptomatic or secondary epilepsy is where there is a known cause for a person's epilepsy. Most people with epilepsy can be successfully treated with AIDS. AIDS do not cure epilepsy, but can prevent seizure from occurring. There are many different aids. Generally, they work by changing level of chemical in your brain that conduct electrical impulses. This reduces the chance of seizure. The type of aids recommended for you will depend on a number of factors, including the type of seizure you have, your age, whether there are any concern about certain aids interacting with other medicines, and whether you are thinking of having a baby.
Bipolar. Bipolar disorder, formerly known as maniac depression, is a condition that affects your mood, which swing from one extreme on another. People with bipolar disorder have periods and episodes of depression, feel very low and lethargic mania. Feeling very high and overactive symptoms of bipolar disorder depend on which mood you're experiencing. Usually simple mood swings. Each extreme episode of bipolar disorder can last from several weeks or even longer, and some people may not experience a normal mood very often. What causes bipolar disorder? The exact causes of bipolar disorder is unknown, although it is believed a number of things can trigger an episode. Extreme stress, overwhelming problems, and life-changing events are thought to contribute, as well as genetic and chemical factors. The following treatment options are available. 1. Medication to prevent episodes of mania, hypomania, low mania, and depression. These are known as mood stabilizers and are taken every day on a long-time basis. 2. Medication to treat demand, symptoms of depression and mania when they occur. 3. Learning to recognize the triggers and seek of an episode of depression. 4. Psychological treatment, such as talking therapies which can help you deal with the depression and provide advice about how to improve your relationship. Laryngitis. Laryngitis is inflammation of the larynx or voice box. In most cases, it gets better without treatment in about a week. Symptoms of laryngitis can begin suddenly and usually get worse over a period of 2 to 3 days. Common symptoms of laryngitis include 1. Hoarseness, 2. Difficulty speaking, 3. sore throat, 4. mild fever, 5. reacting cough. Voice and speaking difficulties usually get worse each day. You're ill and may last for up to a week after the other symptoms have gone. In a few cases, The larynx can swell and causes breathing difficulties. This isn't common in adults but can occur in your children who have smaller neurons with meningitis is often related to another illness such as a cold, flu, throat infection, or tonsillitis. So you may also have other symptoms such as 1. A headache, 2. Swelling glands, 3. Sunny nose, 4. Pain with swallowing, 5. Feeling tired and itchy. Medical help. As laryngitis often gets better quickly without treatment, you normally only need to see your GP if the symptoms are particularly severe and they last longer than 2 weeks. HIV or human immunodeficiency virus is a virus that damages the immune system by infecting and destroying CD4. HIV disease is caused by the human immunodeficiency virus. If not treated, HIV can get worse and will develop into a serious condition called AIDS. AIDS, or acute immunodeficiency syndrome, is the final stage of HIV infection. The body's ability to fight infection is completely lost. HIV is a lifelong disease. In other words, the HIV virus will remain in the patient's body for the rest of his life. Patients who have been diagnosed with HIV should immediately receive treatment in the form of antiretroviral therapy or ERV. ERV is work to prevent the HIV virus from multiplying so doesn't attack the immune system.
Depression is a group of conditions associated with an increase or decrease in a person's mood. Depression doesn't have a single cause, it can have a range of triggers, and there are many different reasons a person can develop the condition. Some people are affected after a stressful life event, like a bereavement or divorce. Other people experience depression related to illness, job loss, or money worries. When you are going to treat depression, you can, the first, best to go is your GP, and second, you might also have the option to self-refer depending on where you live.
Malaria is a serious tropical disease spread by mosquitoes. If it is not diagnosed and treated quickly, it can be fatal. Symptoms are similar to those of flu and usually appear 6 to 30 days after the mosquito's bite. The initial symptoms of malaria include a high temperature or fever, headache, sweats, chills, muscle aches or pains, vomiting, or diarrhea. Malaria is caused by the Plasmodium parasite. The parasite is spread to humans through the bites of infected mosquitoes. The Plasmodium parasite is spread by mosquitoes. When a mosquito bites a person already infected with malaria, it becomes infected and spreads the parasite to the next person it bites.
Migraine is usually a moderate or severe headache felt as a throbbing pain on one side of the head. The exact cause of migraines is unknown, although there are thought to be the result of temporary changes in the chemicals, nerves, and blood vessels in the brain. There is no cure for migraines, but a number of treatments are available to help reduce the symptoms. These include painkillers, including over-the-counter medications such as paracetamol and ibuprofen, triptans, medication that can help reverse the changes in the brain that may cause migraines, antiemetic medication often used to reduce nausea and vomiting. Asthma is a common long-term condition that can cause coughing, wheezing, chest tightness, and shortness of breath. Asthma is caused by an inflammation of the small tubes called bronchi that carry air in and out of the lungs. If you have asthma, the bronchi will be inflamed and more sensitive than usual. Common asthma triggers include house dust mite, animal fur, pollen, cigarette smoke, fatigue, viral infection. Asthma can also be triggered by substances, allergens, or chemicals that are inhaled while working. Talk to your doctor if you think your symptoms are worse at work and better during the holiday.
So that's 5 diseases we've presented. Disease can be such a mental illness like anxiety, bipolar, and depression, and can be physical attacking disease such as malaria, flu, COVID, kidney stone, migraine, HIV, laryngitis, arthritis, epilepsy, insomnia, and asthma.